All right, welcome back. We are talking about the COVID-19 vaccine with experts from the Triad's three largest health systems. Dr. Christopher Ohl with Wake Forest Baptist Health, Dr. Ashley Parrott with Novant Health, and Dr. Deanne Brooks, Chief Pharmacy Officer with Cone Health. And so in about 20 minutes, we want to give you the opportunity to ask your questions to them. You can go ahead and start texting those questions to us. The number to text is 379-5775. This is a text only, so do not call with your question. Again, text only. We'll start taking your questions in about 20 minutes. But first, though, we want to talk about the vaccine process itself. So let's talk about that. The vaccine distribution process, Dr. Brooks, talk a little bit about how the doses get sent to you, and do you get all those requested doses from the state?
Yes, so we receive a message from the state weekly, and we are given our allocation for that next week. What has occurred that's changed most recently is that the state is giving us a 3-week baseline. So we know for the next 3 weeks, this is how much vaccine we will receive. And once we receive that allocation, we can choose to accept it, or we can choose to only send partial, or we can say, no, we don't need any right now. All of our citizens are vaccinated. And then the way the vaccine gets to us is it's either shipped directly from the manufacturer, or it's shipped from a wholesaler. Pfizer is shipped from the manufacturer, and Moderna is shipped from a wholesaler.
Okay, so it's kind of different how it all works there. So we want to make sure that everybody knows it's not just that simple process if it all just comes down the pike in one way. Dr. Ohl, let's talk about why the appointment process is so very different for every single health system. And just to make sure, yep, I see you there, unmuted there. Why is it so very different?
Well, I think there are a lot of reasons. One of it is that it comes down to the usual electronic medical records and appointment systems that health systems have and use. And so we try to integrate making appointments into that because it creates a more seamless workflow for the vaccine clinic, which is a lot of jargon, but it means you use what's already working for you. And so the county has something different, and each health system has something different. The problem that you know, and the frustration is that this is like a really big game of red light, green light. If you remember that kids game, where you're all of a sudden get green light, vaccinate, 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 and then someone says red light, no more vaccine, and then you got to stand down or cancel appointments and rework your workflow again. So I think it'll be a lot less frustrating for everybody, patients, citizens, and us health systems, when we get into a little bit more of a regular flow and get out of this red light, green light phenomenon. So, but it is what it is, and as people get used to finding, you know, the information they need to make an appointment, and a big hats off to WFMY for the tutorial on that. I think it'll help people get through it.
Right, and we are going to get the tutorial on Novant and also Wake Forest Baptist as well, and everything is online, so if you don't catch all of the information, that's okay. We've got it there for you. Hey, Dr. Brooks, let's talk about why do the appointments seem to open so sporadically? That is a question that we get from viewers all the time.
Yeah, so it is a little bit of what Dr. Ohl was sharing with the red light, green light game. And then the other thing that is occurring as well is our prioritization framework. So as different groups are opening up, the beginning groups were a smaller group. They were our healthcare workers. And then as we have opened up to those 65 and older, that has contributed to that sporadic nature. And again, going forward, I think being able to know, at least for a 3-week period of time, consistently how much vaccine we're going to get, we'll have more consistent appointments to be able to open up for our patients.
All right, and let's kind of now go on to, is there a secret? So Dr. Parrott, I'm going to give this one to you. Is there a best way to get an appointment? I mean, we've got viewers who are like, there's got to be a secret to calling on a certain day or signing up online or something.
So there's no special secret. I think we would all agree that the online process is preferable for patients. Getting onto MyChart is the easiest way to find a vaccine appointment, and getting on our wait list helps with that as well. We will send out messages, and you don't have to sit and wait on hold with someone on the phone if you use the MyChart access.
Okay, and so that is for your specific health facility. That's for Novant, the whole MyChart thing. Okay, now let's talk about the biggest appointment problem that you seem to be running into. Is it wrong age group of people trying to jump in line? Is it people not having information? What does it happen to be?
Our biggest problem is really the amount of vaccine that we have to give. We are happy to help patients to schedule appropriately into the right age groups, but as we have bigger and bigger allocations of vaccine, we'll be able to vaccinate more people.
All right, Dr. Ohl, are there any reasons other than being in the wrong group of people that someone would be turned away from an appointment?
That's the main one. Or if the health system you're working with doesn't have the vaccine, you might get turned away until the vaccine becomes available. But I think the whole prioritization is a little bit confusing for people, and it's changed a couple, 3 times since Christmas actually, and so right now we're still trying to get our over 65 people, the people who really suffer the most from COVID, and after this, we're going to be opening it up more for critical and frontline workers. And that's a large group of people. And so it's really going to expand the number of people who are eligible for vaccines. So when that happens, I think some of the difficulty in getting appointments might actually get worse for them.
Okay. So, one of the things to keep in mind is just like all of us, I mean, we've all had to transition from work from home. They're transitioning into doing this whole vaccine thing. Like, things change as things are learned and processes are refined. So things will continue to change, but hopefully for the better as we go along with this. Again, thank you so much for answering the questions. We're going to have more on the vaccine itself coming up.